In early 2014, 34-year-old Harriet Katusime was restless before becoming pregnant.
I was kind of disturbed by cough within March. Then I went to some clinics. I bought medicine, but it was not cured.
Still unaware of her exact ailment, she became pregnant, and the disease troubling her continued alongside the pregnancy. In September, she came to Shigana Maternity Clinic in Kawempe for antenatal care, as is required of expectant mothers as per the policy guidelines of the Ministry of Health.
Then Sao told me that I should take what? I should be tested for TB.
The results came back positive. She was in her 6th month of pregnancy.
That medicine of TB they gave me is the one which stopped the baby to be what? To be affected by TB.
TB in pregnant women is a very delicate situation, and that's why it's so important that it gets discovered as soon as possible so that the pregnant woman can get started on treatment to prevent her child from contracting the disease.
The Centers for Disease Control and Prevention, CDC, however, says it's rare for the baby in the womb to contract the disease, but it does happen. Other risks to the baby, according to WHO, include a 6-fold increase in perinatal deaths immediately before and after birth, as well as a 2-fold risk of premature birth and low birth weight. There is also a possible increase of HIV transmission risk to the baby in case the mother is HIV positive. The baby is also in danger of infection after birth.
As the mother is coughing, as the mother is sneezing, as the mother is laughing, the child is so close. Because of that, the child can easily breathe in the germs from the mother. The immunity is very immature. There is no protection.
TB is equally dangerous to mothers and affects maternal health in general. For pregnant women with HIV, it's worse. In Africa, TB rates are up to 10 times higher in pregnant women living with HIV than those without HIV.
If after doing the assessment, you find out that probably this person does not have tuberculosis, then the best they can have is the isoniazid preventive therapy, which is now recommended for HIV positive individuals.
The possibility of infertility is high as well, especially when a woman has TB of the genital tract.
If it has affected the ovaries, depending on the extent of the damage of the ovaries, the ovaries may become infertile. They could not produce any eggs anymore. If it has affected, probably even extending to the fallopian tubes, then probably there would be scarring.
The Ministry of Health, together with partners, has taken to training midwives in diagnosing and treating TB so that the mothers can receive their drugs from the same center.
By the time they deliver their children, probably the risk is non-existent because then they are already on treatment or they have already treated that tuberculosis.
By 28th December, when Harriet gave birth, she had already been on medication for 4 months. In the first month, she was already less infectious.
And that's why Katusime's child is now not on IPT.
Isoniazid prevention treatment, or IPT, is given to newborns without TB but with TB-infected mothers for about 6 months, and these are advised against the BCG vaccine until then.
Right now, the policy is all children less than 5 years who get in contact or who are in contact with a person who has tuberculosis, okay, should be given what? The isoniazid preventive therapy.
The importance of women attending antenatal care can't be ignored since most services are now integrated.
So a lot of work is needed in that area, but probably it's not happening. Right now, if you look, IPT, it's mainly in adult clinics. Not much has been done in what? In antenatal.
The village health workers attached to this private maternity, Chiganda, say there is a worrying trend where some men adamantly refuse to tell their wives whenever they are tested positive for TB.
It has just come in their mentality that TB is an airborne disease. But formally they know that TB moves with HIV.
But the fact remains that the two influence each other. The team, however, tirelessly continues to sensitize the community and encourages husbands to test for TB and HIV together with their wives when they come for antenatal care. In helping to reduce transmission from mother to baby after birth, including during breastfeeding. The Ministry of Health alongside the union has developed a Detect Child TB program to help improve management of TB. This is being piloted in 2 districts, Wakiso and Kabarole. Florence Nalimba, NTV.